eating pattern that I'd like to talk about is the Mediterranean diet. We really consider the Mediterranean diet more of an eating pattern than a diet. And when we think about the Mediterranean diet, this is the one diet that we have the most data for in terms of decreasing or preventing chronic medical conditions. So we could read on the slide, with the Mediterranean diet, there's a lower risk of all-cause dying or mortality, heart disease, metabolic syndrome, which is prediabetes, cognitive decline, depression, cancer, and specifically breast and colon cancer, in addition to dementia. And so why I say this is a eating pattern, because there's not just one Mediterranean diet. For example, when we think about the countries around the Mediterranean Sea, the Mediterranean basin, it's comprised of multiple countries. So to the north, there is France, Spain, Italy, Greece, Portugal. To the east, there's Turkey, Syria, Lebanon, Israel. And then to the south, Morocco, Egypt, Libya, Algeria. So we're going to make this interactive. So in the chat, and let me get the chat up again, I'd love for you to write in if there's a country you would love to visit to eat the local foods in the Mediterranean of the countries I've mentioned. Which country would it be? So Italy, Greece, and Greece with an exclamation point, Italy, Greece, Lebanon, Morocco, Spain. And so you guys can keep on going, and I'll go ahead and continue with my presentation. So when we think about the Mediterranean diet, we could think about the Mediterranean pyramid. And here we go. So when we think about the Mediterranean pyramid, it's this idea that the Mediterranean diet is not a structured diet. It's a pattern eating, and it's a balanced diet. And there's lots of variety within the Mediterranean diet. So if we look at the base of the pyramid are the food groups that we should eat in abundance. At the top of the pyramid, those are the food groups that we should eat minimally. So if I talk about it generally, the Mediterranean diet is a diet that's rich in unsaturated fats. Specifically, the cornerstone would be olive oil, but it could also be other unsaturated fats like canola oil, nuts, avocado. And why fat is important in our diet is that fat allows for us to enjoy the food better. It allows for food to taste better, and it allows for absorption of fat-soluble vitamins. So the fat-soluble vitamins would be vitamin A, D, E, and K. At the base of the pyramid, the foods that we should eat in abundance would be high amounts of vegetables, fruits, legumes, grains, specifically whole grains. They have more nutrients. Fish and seafood would be less than the plant-based approach, and then a small amount of eggs, cheese, and yogurt, and minimal red meat and sweets. And if you look to the left, you'll see wine. So wine, it says in moderation, so it's low to moderation. So for a woman, that would be 1 drink a day. For a man, that would be 2 drinks a day if someone chooses to drink alcohol. And then if you also notice that drinking water is also part of the Mediterranean diet. Water is essential. We say on average 8 glasses of water a day, but it really depends on how much physical activity someone gets. It depends on the environment that we live in, our age. So that's something that we can think about as well. And when we think about the Mediterranean diet, it's a diet that's rich in omega-3 fatty acids. Omega-3 fatty acids allows for us to decrease inflammation, and we can get that through fish like salmon. And at the very bottom of the pyramid, it reflects that idea of being physically active and the social aspects of eating. And this is a part of the Mediterranean diet that we don't talk about enough. That idea of creating a community, that idea of enjoying our meals with others, that's an important part of the Mediterranean diet, as is getting physical activity, just a part of our day in terms of physical activity.